Hi, and welcome to Chicago's Tomorrow Interviews Chicago's Today, brought to you by UCAN. I'm Maya Hunter. Today I'm visiting University of Chicago Medical Center, where I'll be interviewing Dr. Perpetua Goodall. Thank you for being with us today, Dr. Goodall. Can you briefly introduce yourself and tell us what you do?
Well, thank you, Maya, for inviting me to talk with you. It's my pleasure to get to know you and tell you about my work. So I'm Dr. Perpetua Goodall. I'm an obstetrician gynecologist here at the University of Chicago. I've been in practice here for going on 18 years. And what I do is sort of a combination of things. I do obstetric care, which is providing prenatal care to women as they go through their pregnancy. I provide care for them during their childbirth and then afterwards. As a gynecologist, I focus on preventive health care for women, and I also take care of conditions that affect the reproductive system of women.
Well, that is wonderful. So why did you choose your specialty in medicine?
So, I really think that OB-GYN combines an opportunity to provide primary care for women, and it also gives you an opportunity to do procedures. So I really like working with my hands, and I think OB-GYN uniquely combines both of those things. So I have a lot of variety in my day. I get to see women from adolescence through the menopause, and so I get to see a lot of different types of patients. I get to meet a lot of different patients and from different backgrounds. And so I think OB-GYN is a very special field that gives you a lot of opportunities.
What do you like most about your medical practice?
I really enjoy the patients and just talking to patients, getting to connect with them on a personal level. Patients are sharing some of the most intimate details of their lives with you, and so it really gives you an opportunity to develop meaningful relationships over time. And I really take pleasure in getting to know families and taking care of moms, daughters, sisters, aunts. I really enjoy taking care of a group of women and taking care of their families and their communities.
So besides seeing patients, you are a professor. So what do you like about teaching?
Well, I think teaching is rewarding on a number of fronts. It's really nice to be able to see students grow over time, to be able to have an influence on a future generation of healthcare providers and doctors, being able to share the knowledge that I've developed over time, being able to continue to develop my own knowledge and improve and grow. And so I think it's both rewarding as a student and as a teacher. It also gives you an opportunity to give back or contribute to the system that helped you to get to where you are. And the other things that I like, I think it sort of keeps you on your toes. Being a teacher, you have to keep up with research and keep up with up-to-date practice. And so I think it really makes me a better clinician. And that I'm able to, if I'm able to explain a complex topic to a medical student, then it sort of makes it easier for me to explain that information to my patients. And so I think it's really nice to have patients come along with me, or have students come along with me when I'm seeing patients, and they learn from me at the bedside. And it's really a special experience to be able to share my knowledge with other people and really help the growth and development of young learners.
As we were talking out in the hallways in the beginning, I wanted to become an OBGYN. What steps do I need to take to see if I am really passionate about becoming a doctor?
So I think taking advantage of opportunities like this to talk to doctors in different specialties. So you may find that OB-GYN is not what you have a passion for. You might shadow an internal medicine doctor, a pediatrician, a surgeon. So I think taking every opportunity possible to really get to talk to different doctors in different specialties, different types of practices, because you get to see the work that people do up front, and you can actually get your feet wet and see if it's something you'd really like to do.
What do you think are some great qualities of being a good physician?
The qualities that I would most expect to find in a good physician would be caring, compassionate, empathetic, and then knowledgeable and competent and confident but not arrogant. So someone that you can relate to and have confidence in but not feel that they're not approachable.
So finally, why do you think the careers in medicine are important to the future in Chicago?
Wow. So I think you can probably look at it not just limited to Chicago, but the health of a society has so many effects on other aspects of the community. So like productivity, economic development, education. I think if you're not healthy, you're not able to contribute to your community or to your society. So I think doctors play an extremely important role in maintaining and establishing healthy communities. So providing education to your community about preventive health care strategies, about maintaining your health, and also treating health conditions. So having access to quality providers, having access to knowledgeable providers, providers that care about their community. So I think it's extremely important that people like you want to go into the field. Looking at the number of minority physicians is still an area where work needs to be done. So I think patients find that or studies have actually shown that people or patients may do better, minority patients may do better when they have a provider that looks like them. And so I think it's important to have or to recruit people like yourself that want to give back to their communities, that want to practice in their communities, and sort of contribute to the health of their communities.
Well, thank you, Dr. Goodall, for being here today and taking time out. This has been Chicago's Tomorrow Interviews Chicago's Today, brought to you by UCAN.